So this comment comes from an older video of mine talking about wounds after breast reduction. So if you have a little wound after breast reduction, can you just stitch it back up? And the simple answer is yes, but it's unlikely to work. So when you get a wound after a breast reduction, it's typically a blood supply issue. So the area had its blood supply altered in the process of doing the breast reduction, and so the area didn't heal well because there's not adequate food for the area to heal. So if you put it back together, the same thing's going to happen. So you are not fixing the problem. Now, after surgery, your blood supply will figure life out after a while, but this takes a long time. So this is not going to happen for probably 1 to maybe even 3 months. When you have wounds after breast reduction, they heal more slowly than you expect. If you had a wound the same size on your leg or arm after trauma, it would heal much more swiftly than something after a surgery like this. Now, there are some situations where we can stitch these wounds up. So if you've had the wound for quite some time, sometimes they are healing in a way that doesn't allow them to close up on their own. And so for patients like that, it's been long enough out, you assume the blood supply has beefed up and is more close to normal, you can actually go in and do some cleaning of the area and then close everything back up. But I probably wouldn't consider that until I was closer to 2 or 3 months out from your surgery. So in general, no, you don't want to stitch these things up. They don't open up because it's a failure of the stitching. They open up because it's a failure of the blood supply to the area, and we can't fix that with some extra stitches.